The vision for Natural Health Service is actually quite simple. It is to help people. The stigma of cannabis still exists in today's world due to prohibition. We're rapidly moving towards legalization, but a couple of years ago when we started Natural Health Services, there weren't a lot of physicians that were open to that conversation. So our job at Natural Health Services is to start that conversation and go out into the world and educate physicians and educate people on the medicinal use of cannabis. So what we created was a system that allowed patients to come in, openly talk about cannabis, allow us to educate them about the proper strains to use, while working and making it easier for physicians to come and work in our clinics and enjoy the process and be able to offer high-level patient care. Well, we created the Education Center in order to be able to illuminate and help people understand, bring to light that cannabis can be used medicinally, and here are some ways that you could do it based on the illnesses that you have.
I think what I like about my role here is I'm kind of in the peace of mind business. Really, what people are looking for is somebody that they can trust, somebody who is in their shoes, basically. We've all been there, and we've all used alternative methods in the past. We've turned to cannabis as an alternative, and it's worked so much better. They can see that we've experienced it personally. We're not just, consultants that are reading it from a book. We've actually lived it. And I think that comes through. I think they know that they can trust us.
Our educators do not offer medical advice, they just offer education about cannabis generally. So they'll teach them about CBD, they'll teach them about THC, they'll explain the different strains, indica, sativa, hybrids, and they'll tell them when a particular strain would be good. What we do as well is we register patients with licensed producers and spend a significant amount of time explaining the licensed producers to the patients. We find the right licensed producer for the patient, and then the patient ultimately selects that licensed producer for themselves.
I think one of the nice things about NHS is our ability to pivot and shift and respond to public demand. People are hungry for this information. They're hungry for the education. We're giving it to them in all sorts of different formats so that they can access it. It's a learning curve, but even the basics about the plant, as we know it at this point, are phenomenal. And people are really wondering why it's been on the back burner for so long. Education is pushing it to the front burner.
So where I think that this goes is education. Education is really, really important, because the more that you learn about cannabis and the proper use of cannabis means that it can be used more successfully. And another thing that you're going to see is a lot more scientific research and studies done on different ailments and how cannabis affects them. Cannabis is a movement. Cannabis is coming out of the shadows, and for the first time in a very long time, we have the ability to access a plant-based medicine that is fantastic for many, many different illnesses.